have been good. But anyway, hi, my name's Ian Davis. What I want to do first of all is apologise because I've got a very dry throat that's getting increasingly sore as I'm speaking. So apologies if I keep slurping on water, and also apologies if I sort of truncate some of the things and don't go into long rambling anecdotes, just to try and save my voice. So this session is a joint one put together by my colleague Paul Osmond. And Paul is a pedagogic research fellow here now with Scopal, but has for a long time been with us in the Department of Biological Sciences as a biologist and as a physiologist, and as a colleague on our healthcare science apprenticeship course. So what I'm going to be talking about is our healthcare science apprenticeship and how we have taken a view of learning on that particular programme. And really, before I do, I want to set the context. So healthcare science degree apprenticeship is a programme, a degree apprenticeship programme, which trains people, educates students to become biomedical scientists. And biomedical scientists are the people who work across the NHS. They are involved in blood tests, biopsies, a whole variety of different health interventions that you all have been familiar with through any sort of interaction you have with healthcare. It's a hidden profession. It sits there behind big labs with big closed doors in hospitals, but it's vital and it's a science at the heart of healthcare. Now, these students are on programme with us for 4 years on this degree apprenticeship, and they finish with a degree that allows them to register on a national register, on a statutory register with the Health and Care Professions Council. We started this programme back in 2017, and that was really to capitalise on a need, first of all, from employers to have a sustainable pipeline of students coming in and joining the workforce, becoming registered biomedical scientists and being that sustainable talent pipeline. It coincided with degree apprenticeships. It coincided with the launch of degree apprenticeship standards. And so in 2017, in conjunction with our workplace partners, we put together this course, and we had it accredited by a variety of professional bodies, of whom I'll talk about in a second. We took our first intake in 2017. In 2018, the innovative approach of the award, and that was mainly through the blended approach, the distance learning approach, led to a number of national awards. And because of that interest spread, we increased our student intake, and our first students graduated on time in 2021, given that they'd been working in the middle of a pandemic, leading the diagnostic response to COVID-19. In terms of reach, we've got about 110 students on programme at the moment, and they cover around about 25 NHS trusts all across England, where the apprenticeship levy is set. And those students are travelling in for study days. They're having blended learning online, but they cover quite a large geographic reach, and that's the key part. And so our delivery has to make account of that. If you were to trace on top of that map the UK mainline railway stations, you would see how it all fits together. Most of them are coming in by train for their study days. The course at the moment is 4 years. We're moving from September to a 3-year delivery model using more of the summer teaching period. And it's a BSc Honours in Healthcare Science, and it embeds a lot of the professional practice elements that they need to complete what's called their IBMS portfolio, their Institute for Biomedical Science portfolio, which is their gateway to registration. So just as nurses would register with the NMC and doctors would register with the General Medical Council, registering with the Health and Care Professions Council is our gateway to be able to practice autonomously as biomedical scientists. Of course, then it does also fit in the level 6 standards for healthcare science practitioner. The course itself, we designed from the start to be blended. Before blended became such a sort of well-known and much discussed term, we were a little bit ahead of the curve because we were looking at blended learning just to meet our market. Our employer partners wanted students mainly in their lab, and so we integrated workplace learning and distance learning. We needed them on campus for certain elements, so we had on-campus study days. So the blend that we use for blended learning is really work-based led for a lot of their competency assessments, their demonstration of professional skills and behaviours, and generating the research project for their final year. On top of that, they have weekly online learning, and we'll talk about that a little bit in the second and also in the follow-up talk in the bottom half of this particular stream. And then they have their on-campus days when they are on campus here 9 days a year in 1 or 2 day blocks, actually involving practical sessions in the Science Centre, discussions, debate, interaction with service users, and some interprofessional education. So that's our blended model. And as I say, our blended model came really from necessity of the employer and the student. And before blended learning was really a thing in the mainstream educational setting post-COVID. Because of the various elements of regulation and registration associated with the course, it embeds the knowledge, skills and behaviours that they need to be able to practice as an autonomous registered healthcare professional. And it sets out to follow the curriculum set by a variety of professional bodies. And this is great. This is really good because it gives the purpose of that degree in their career. But it also is complex. We have our professional body, the Institute of Biomedical Science, accredit the programme against the QAA benchmark for biomedical sciences. The National School of Healthcare Science, which is an arm of Health Education England, so a government-funded body, sets the curriculum for the practitioner training elements of their course. Both of them are very curricular heavy, they're very topic heavy. Certainly in the National School of Healthcare Science, the curriculum document is quite a tome of things that they want to have included. It fits the standards of proficiency and the standards of conduct, performance and ethics by a professional regulator, so the Health and Care Professions Council, and then of course it embeds all of the things that are required for apprenticeships, both knowledge, skills and behaviours in the apprenticeship standard, but also the various elements of compliance and regulation that come with that. Now, having all those professional bodies is great, and it gives us that anchor of knowledge that students have. But it's a bit of a balance. The professional bodies, their standards are very content heavy. There is an awful lot of information about what students should know and what students should be able to do on the point of graduation. And that's reasonable, because if you are having a blood test for whatever reason you might present to the GP, you want to make sure that the person doing that knows their stuff. You want to make sure that they can do their stuff. You want to make sure that they're competent and they're knowledgeable. And that's great. But the balance is we also want them to become something, to act in a certain way, have those skills and knowledge, great, but also have the behaviours needed to do the right thing, to identify when things aren't going well, to identify when they need to do things differently, to become that professional. And that's quite difficult. That's difficult for a curriculum to put into a written context. That's difficult sometimes to assess in an exam. And so what we're interested in is how we maintain that balance of pleasing and satisfying professional bodies, that content and skills are delivered, but also looking at that transition of a student, that identity change from being someone who is in a department, in a lab, doing task-based exercises, that transition of identity into becoming someone, becoming something, acting differently, taking responsibility and autonomous responsibility. And that's quite difficult. This came to bear quite vividly in 2020, when we obviously entered COVID, and we had students that were working right from the very start on that COVID response. We have students who are based in Porton Down, which is the rare and imported diseases unit of what was Public Health England. We have students in Public Health England labs across the UK, and we have students then across a load of infection science, blood science labs. So immediately their job changed, their role changed, everything changed. The whole way of working changed. They needed to be agile, they need to be dynamic, they had to be responsive and quite often look for problems before they came. They had to be very proactive in their approach things. They had to adopt very rapidly to new ways of working and also changing levels of autonomy. People that they would have looked for guidance are now being pulled to different tasks. They had to sort themselves out quite often in the workplace, work very differently. Now, to us, that re-emphasised why that balance was important. Having the skills and the knowledge was brilliant, was great, was what was needed, but also that identity, that being, that becoming someone became more and more important in how we deliver the course. Because of all of these things. So Paul and I reflected on this and published our reflections in 2021, just looking at how we need to think about the curriculum moving forward. So we really emphasize these skills, these individual skills that are harder to identify, they are harder to assess, but why they are really important in developing practice. Also, at that point, a big focus came to mind, which was Ofsted. So although we knew the product was good, we knew that students were progressing, we knew that students were doing very well, individually and collectively, we knew how we thought the programme worked as academics talking to one another and talking to students. But in April of that year, we became within the scope of Ofsted as a level 6 apprenticeship. So our challenge was, how would we explain that? How would we have that discussion with an Ofsted inspector who may not have the contextual awareness of what the course was and what it was doing and who the people were, and the history associated with the profession, that professional development, and everybody knowing their place and it all fitting together almost subconsciously. So Paul and I set to pull apart what we were doing and try and identify what learning was, where it happened, how it happened, really as a basis to set our stall out to both Ofsted, but also to have clarity amongst other people. And we were concerned that we were looking perhaps too broadly at the course. We were looking at students as a student body, we were looking at biomedical scientists as the output. But how did we meet that individualisation that was needed by Ofsted and also to satisfy the students and their student journey? And we focused it as a journey, that it's not just about the knowledge and understanding. And we use this terminology when we greet the students and when we have them in induction, and as we move through their course, we would call this their journey. It's about how they think, how they act. And we coined the line that it's not training them to do, but developing them to be. And I think that's important. They are becoming something. They're learning through this participation in various different communities of practice to become something. Now, our population of students is very diverse. It's diverse geographically, it's diverse through a whole variety of parameters, but it's certainly diverse in terms of the laboratories they work, the support that they have, their educational background. So some are coming to us with existing degrees, some of them are coming having had a big break in education post A-level, some of them coming with no A-level at all, coming in through maybe 10 or 15 years experience hands-on in the lab. Because of that, their experience of education is very different. Their ability to learn, their ability to interact is very different. And equally different are their aspirations of where they want to go moving forward. So we started to build what we've phrased as our individual learning framework. And really, it's nothing especially innovative. What it is doing is capturing what's happening and putting on paper as a base model for us to work on moving forward. So what we wanted an individual student to know how their learning was being managed, not the course, not a year, not a module, but them as an individual and how they fitted into that big model. It needed to support their study, obviously, but it also wanted to stretch their potential. We can see the students going through the programme and we can see that they've got a very good trajectory into a future career. We can see the potential that they've got, and we wanted to develop that. And really, we wanted to develop those ideas of critical and autonomous thinking that were needed for that. So I'll just run through the arms of these domains, as we've called them. So the stage 1 domain, and we've put it as this jigsaw. This is their weekly delivery. This is how weekly material is delivered to them. And that involves interaction between the academic team delivering on particular units, particular modules, the interaction they have individually with their tutors, the people delivering on those modules, but also interaction with their peers in the workplace, their peers on the course, bringing in the various different communities of practice in which they work to negotiate meaning, to negotiate understanding of what was being taught, and then talking to their workplace mentor. And their workplace mentor would be a qualified scientist who maybe had done their degrees and their qualifications several years ago, maybe a significant number of years ago. And it's making sure that that continuum developed their practice, but also developed the communities that they were in. They brought those mentors along, so we weren't having to compete with information that had been delivered in the past. So that's the first part. That was the first domain of making sure we were sure who the players were and who their various different communities were. And then the follow-up work will be to look at those interactions between those jigsaw pieces and what makes those particularly effective, where are the barriers. The second part then, the second stage of this framework was to look at how we could make sure students had got access to a whole sort of smorgasbord of different academic support. So everything from digital skills through to well-being, through to academic skills and library skills, all of these coming together to really think about that framework. So we didn't provide the same level of support to all students. That support is there as almost a menu, and we can tick off which particular parts they need to suit their individual needs, their individual backgrounds, and their individual aspirations. The third part then was membership of our academic community and the academic mentoring that comes along with that. And so we developed a mentoring program where we are looking at what skills and what support they need across the levels. So in their first year, we're supporting that transition to higher education. We are thinking about what they need, where they come from, where they're going to develop to try and bring along and translate their existing skills into this framework. So that's themed as explore. As they go into their second year, we want them to start to think about stretch. We want to think about what they need to do to achieve. And that's following the feedback from the first year moving forward. As they develop into year 3, so they're starting on the final year level 6 modules, at this point, we want them to extend and to reach their potential. And that's what we do with our Extend program. And then through the final part of that program, we want them to aspire. We want them to think to the future. We want them to think about what they can be. We use role modeling, so we have people from the profession that we use as role models. We link various different career progressions within that so they can see that this isn't an end point. It can be if they wish. They can work as a jobbing BMS day in, day out and do that, or they can progress. They can be a leader in their profession. They can go into research. They can go into leadership and management or wherever they want to go. And that's that empowering stage of having the aspiration to move forward. And then the final part is oversight. So as an apprenticeship, we have a work-based education officer who works with the students on periodic reviews every couple of months. They are pulling together all of the elements of this framework to make sure it still fits what's needed for that individual, but also then to stretch them further. And then we go through the normal academic processes of boards and review and oversight externally. So we put this together, we published this in 2022, really just as a thought piece, just to get it on paper, this model of academic delivery, this model of individualized learning. And we talk to students from day one, we talk to their mentors, and staff can feed into this. So from an individual point of view, students don't see themselves as a member of a course going through, they see themselves as an individual on a journey. This is their roadmap. These are the people and the key players involved in that. They're aware of those communities involved in that journey, and they can think about their future journey after they leave us and their aspirations. So I'll pause there if anyone has any questions. I'm just going to lubricate, but if there's any questions, then please shout out. Cool. Look at that. In a while, I think after Sarah, I'm going to come back and I'll be talking a little bit more about some of the nuts and bolts of that academic delivery, delivering online, delivering through this blended session. But we'll come back to that in the second session. Okay, thank you.